pleased to have the Congresswoman of the 18th Congressional District, Congresswoman Sheila Jackson Lee. Also, I have with me, who's behind me? I'll introduce this guy very soon, Tashir Badir, who is the CEO of ZT Corporation. And then Chief Acevedo and Chief Pena are here, along with Chief Bunick, and a number of my directors. The unprecedented COVID-19 public health crisis has changed our country and our city in ways we could have never imagined and continue to assess. Over the past 2 months, we have aggressively worked to save lives and blunt the progression of this community spread of the coronavirus. And we are seeing positive results. But we are not yet out of the storm. Let me start off by saying this virus is not currently under control. And let me repeat that. This virus is not currently under control. Today, the Houston Health Department has announced 107 positive cases for a total of 2,923. Fortunately, today, we are not announcing any new deaths. So the death toll in the city of Houston remains at 34. The stay home, work safe order has made a difference. It has saved lives, along with social distancing and face coverings. And just as we are starting to see some progress in flattening the curve, many are urging that we immediately reopen the economy. I want people to understand that many in the medical community are saying that Houston has yet to reach the point, the peak. And once we are there, we must be very measured on how we proceed to avoid a resurgence of the virus. And I know I echo the sentiments of Dr. Peirce. I, too, want to reopen our economy. But if we are going to have that conversation now, we must take a measured approach and follow the guidance of medical experts. And any decision to reopen businesses and send people back to work must also include a plan for testing. The precursor to opening the economy and how we reopen the economy is testing. Widespread, robust, and ubiquitous testing. As we began the conversation, today I am proud to announce that former Shell Oil President Marvin Odom has agreed to serve as the City of Houston's COVID-19 Relief and Recovery Czar. And let me just say from the beginning, Marvin, let me thank you on behalf of this city for agreeing to step up again. Marvin is no stranger to working on disaster recovery, as he served previously as Houston's Chief Recovery Officer after Hurricane Harvey. From all sectors, he received rave reviews for the team he assembled, the task forces he created, and the collaboration that he forged. And throughout his service to the people of Houston, Marvin was instrumental in working with local, state, and federal partners to secure funding and reform policies. He broke new ground in disaster recovery, and he helped move Houston forward to become a more resilient city. Quite frankly, I have seen no person better received by all members of City Council in their work than Marvin. In his new role, Marvin will work with business leaders, Chamber of Commerce, employee groups, nonprofit organizations, and members of my executive team to develop a plan to safely and responsibly move Houston forward. Marvin will have broad discretion to identify solutions and create strategies to safely and responsibly restart Houston's economy and make sure we address the challenges facing our vulnerable and at-risk populations and communities. All the above does not stop at Houston's geographical boundaries. Judge Hidalgo and I have had numerous conversations on how to move both Houston and the county forward. Marvin will work directly with the county's designated representative, in this case, State Representative Armando Walla, who I know very well, to forge a cohesive strategy and plan for Houston-Harris County. Reopening must be done in phases, and there are 4 critical issues I want Marvin to focus on as he moves forward. Number 1, how to restart the economy in Houston. Before we send people back to work and reopen businesses, we must also have robust, ubiquitous testing. Business leaders should have a plan for testing and ensuring the safety of their employees. And in a few minutes, we will hear how one such company is leading in that area. Houston's 2 testing sites have the capability to test 1,000 people per day. Houston needs to test 3,000 to 5,000 people per day to get a better sense of where this virus is and the extent of the community spread. Once we know where it is, we can isolate it and better protect the general public. 2, strategies and adjustments if we see increase in positive cases. We also must consider what happens if we reopen the economy, people go back to work and their regular routines, and we start to see an increase in the number of positive COVID-19 cases. Part of Marvin's charge will be creating a plan in case Houston has a resurgence of COVID-19, and contact tracing is a major part of that strategy. 3, protecting at-risk vulnerable populations. Marvin will work with a task force I have already appointed. It is led by the directors of Complete Communities, Education, Faith-Based Initiatives, and Resiliency, and they will identify issues and find collaborative solutions for vulnerable communities and populations within our society. As we restart and move forward, we must ensure that those populations are not left behind. And 4, how do we prepare for the next pandemic viral attack? Houston is a resilient city with a resilient community, but I have also charged Marvin with developing a plan to prepare the city for the next pandemic or viral attack. And he will be working with Marissa Aho, the city's Chief Resilient Officer, and will develop an addendum to the Resiliency Houston Plan that specifically addresses COVID-19 and the shocks and stresses associated with this crisis. Harvey created a unique set of challenges. So does COVID-19. And I can think of no better person to lead our recovery effort than someone who is already familiar with huge challenges of Houston's past. And now I'm pleased to introduce the Chief Resilient and Relief Czar for the City of Houston, Marvin Odom.
Good afternoon, everyone, and thank you, Mayor. I think the good news here from the very start is you're going to see a lot of commonality between your comments and mine, which it's good that we're already on the same page. I also want to say thank you to all the Houstonians who have taken this crisis so very seriously and heeded the advice of our extraordinary public health officials. It's because of this that we are able to be here today to talk about the steps necessary to reopen Houston. I also appreciate the leadership from the mayor and the county judge during this difficult time, including the focus and the deep understanding on the importance of returning Houstonians to work. To be clear, this is about keeping people safe and getting people back to work and re-energizing our economy. We have been charged with completing the plans that will reflect that delicate balance between the need to return to work and the necessary vigilance required to keep people safe and healthy. As we put these plans together, there are some guiding principles that will steer us, and I wanted to share 3 of those with you today. The first is that we will act as quickly as possible because we understand the desire and the need to do so. Our speed will ultimately depend on a number of factors, like testing and contact tracing, to confirm our return is meeting our criteria of keeping people safe. Second, our approach will be inclusive. We will bring together a broad group of stakeholders to ensure that this plan reflects all Houstonians. We will need social services, nonprofits, civic and faith leaders, education, and importantly, the business community, all to rally around this plan. This plan will prioritize the most vulnerable populations and their particular challenges. Taking into account, for example, individuals that might not be able to buy a mask or see a doctor, just as one set of examples. Fortunately, as the mayor mentioned, he's already kicked off a task force, so we're already up and running in this respect. Access to the business community will be through channels such as the Greater Houston Partnership, the Houston Hispanic Chamber, the Greater Houston Black Chamber, and the Asian Chamber. It will also include the views of small businesses that aren't necessarily plugged into those organizations, but make up a large portion of our economy and the employment in our city. The third guiding principle I wanted to mention today is that we are here to collaborate with everyone that I just mentioned, and first and foremost with the county. We will work closely with the state, and we will work with the federal government where appropriate. The key point here is we don't want to duplicate work or waste any time. Rather, we'll be tailoring well thought through frameworks. Think of a framework like it was put forward by the governor here recently. But we'll take those frameworks and we will account for the uniqueness of Houston and Harris County, including our position on the infection curve, and adding the necessary details for local implementation. I want to take a moment now and just mention a few characteristics of what I would consider a successful reopening plan. And the first is one that the mayor mentioned, and that is testing and contact tracing. Now, no surprise here, and no surprise that that's a key topic, and also we're fortunate in Houston that we're blessed with an extraordinary medical community that's already front and center and working on these issues. We all know that this is the very basis of successfully reopening our economy. In addition to the capacity questions that we have to address, we also will need to think through how testing can be strategically applied to support our return to work plan. I think of this as testing at the right place, at the right time, and at the right frequency. Now, this will be critical to developing the confidence that we all want and we all need. The confidence that our reopening steps are working the way that we intended. Now, contact tracing, while not nearly as far along as testing, will need to be an area of focus as well to ensure that we do not inadvertently create new hotspots of infection. I will emphasize again that it is this testing and tracking, along with the safety and distancing protocols that are in place and lagging indicators such as the number of hospitalizations, that will be required to build the confidence that our reopening plans are working and that we're not just hoping for the best. Another and second key aspect of a reopening plan is the ability to identify problems early and make adjustments, and you heard the mayor refer to this. Now, this is clearly related to the testing and the tracking that we've talked about, but my point is that this requires forethought and transparency regarding how we will respond to negative indicators if they surface. So we'll include that in our planning scenarios. A third aspect is that the federal government has allocated money to Houston to help us fight this battle, and that's critically important to us. But we also know that every part of the country is somewhat unique in its challenges, and we'll be working with the federal government with a lot of local support to ensure that we have the flexibility in that money to spend it in the most effective way for Houston. I think we have a good history of success here with our representatives, but this will require some time and attention. Now, the final aspect that I'll mention today is that we need to answer how we can better prepare, as the mayor said, for another event similar to what we're going through right now. Now, this is not the immediate work at hand, but recognizing now that we want to get there in the end is important. Key opportunities that will naturally reveal themselves as we go through this recovery process, and we want to do the work of capturing those opportunities and the recommendations as we move through, and that will be something that we present at the tail end of this process. I'll close with a final thought. You can expect that this plan will be gradual and phased, and I'm sure we all understand why things cannot immediately return to what we like to call normal. We will need the continued cooperation of all Houstonians to ensure this plan is successful. And I commit that we will provide more details as soon as possible. So thank you very much and stay safe. Mayor?
Thanks, Marvin. We all look forward to working very closely with you as we move forward. As we begin the discussion about transitioning back to work and reopening the economy, businesses need to create also their own plans. And the plans must cover issues on how they will allow for social distancing and protect employees from spreading the virus and creating another surge. Today, I want to highlight the work of ZT Corporate of Houston, who is an important player in the city of Houston, and someone who has come and assisted the city of Houston on multiple levels in the past. Tashir Badia is the chairman and CEO of CT Corporate of Houston, and earlier, well, about 2 weeks earlier, we were discussing testing in the city of Houston. And in fact, it was Tashir who called me and said, Mayor, I know that the city of Houston is limited in its testing capacity. And then as we open testing to everyone, the 2 public sites have been overwhelmed. Today, as in the previous days, we will have reached the maximum capacity, 1,000 tests a day, right around 3 o'clock, 3:30, when we are scheduled to keep those sites open till 7 p.m. So there's no question that we need additional capacity. And the conversation that I've had with Tashir, what he indicated is, Mayor, I am the chairman and CEO of a corporation of about 1,500 employees. And I have an idea, and that's about if a company like mine were to go and test our own employees, we could help to ease the load or reduce the load on your public testing sites. And so Tashir Badia is here today to talk about his plans to protect his employees and protecting his own employees, helping to protect people in the city of Houston as a whole. So let me bring him up to discuss his plan as it relates to ZT Corporate of Houston. Tashir.
Thank you, Mr. Mayor. Congressman Lee, welcome aboard. Really looking forward to working with you. I hope that one day I can give you a hug soon. It's coming, I promise. Mr. Mayor, thank you for your leadership for our city. Mayor Turner, you've always partnered with me and the community in general to keep Houston safe and Houston strong. My name is Tashir Badar. Like the mayor said, I'm CEO of ZT Corporate. We've been in business 23 years. Houston is my home. It's my heart. We're CEO of a mid-sized company, mid-sized private equity company headquartered here. I'm committed to find ways to help with this collective fight to wrestling with this virus and the city. We need to get the city going again. I am grateful to all the healthcare professionals and frontline workers, 1,150 whom work with me at ZT and our various medical facilities and our auto dealerships. In gratitude to them, ZT is committed to responsibly and safely transitioning back all of them to work with the public health topic front and center. Our city and public health sector have done a yeoman's work responding to this crisis with testing and by taking care of Houstonians. But this is an all-hands-on-deck moment. It's been the government. We need the private sector to help. In the spirit of JFK's historic words, it's not asking what the country can do for you, it's what you can do for your country. The private sector has a responsibility to harness our entrepreneurial innovative spirit and find ways to step up and to save lives and livelihoods. To add capacity to our cities and counties' ability to test and make our employees feel safe, ZT Corporate will be offering a voluntary paid COVID-19 testing to all 1,150 of our employees in the greater Houston area and 500 employees in our other locations in Georgia, Florida, New York, my other hometown, New York City, and Arizona. We are stepping up for our employees in our city and compel our contemporaries, other mid to large size companies that are much larger than ZT, to do the same for their employees. Together, we can play a pivotal role in moving our city and country through crisis toward recovery, responsibility, responsibly and also that's sustainable. Before we can require everyone to return to work in the U.S., I think everyone has the right to be tested. You know, the fear of the slap is harder than the slap. If we know the data that we have, like the mayor said, we can move responsibly. We are offering this to all of our employees, this at no charge. We are covering their costs completely. We're trying to get this all done by April 30th, all 1,500 employees. I'm challenging other Houston CEOs and leaders in this great city to save our families, for the city, and for our future. We are Houston proud and Houston strong. Our unique resilience comes from the spirit of working together. Let's do all what we can to get our city back to work and back to health. Thank you.
Thanks, Tasha. And as you can see, working together in collaboration, both the public, the private sector, we can get this done. And the more testing we can do, the more widespread the testing can be, the quicker, I think, that we can move through these stages that Marvin will be establishing for the city of Houston. And then to complete the puzzle, what's happening in Congress even now is critically important. And the Congresswoman and I were talking late last night in terms of providing additional assistance to the cities, because that becomes a part of the collaboration. So, Congresswoman Sheila Jackson-Lee.
Thank you, Mayor, very much. And my presence here today is to affirm a very solid, somber, but serious and productive way to lead any recovery. Thank you, Mayor, for the judgment that you've utilized. Thank you to the council members and Mayor Pro Tem. Thank you to Marvin, if I might call you by your first name, because we have worked together in many other disasters, and we see where Houston is right on top. Thank you to Sheer for your great leadership and your company. Testing, testing, testing. That is the roadmap that the mayor has chosen, and that is the roadmap that we're working on in Washington. As I go back to Washington, we'll be advocating for legislation on an interim funding of $25 billion for testing. The main question of that is to ensure that those testing dollars, like the mayor and, of course, Marvin has said, is that they are directed not only to those who need the test, but to the hotspots, to ensure that we cure those hotspots and find out who's positive and who's not, but to give the local governments the flexibility that they need to continue their pathway. We will be advocating, as the mayor and I have discussed, and I think is extremely important, that our funding will include, going forward, access to revenue loss. We will face a uphill battle because we will be dealing with the monies for PPPs, and that is our small businesses, which we are very concerned about. But we have strong advocacy for revenue loss for our cities, flexibility for our cities, and as well to ensure that FEMA has 100% contribution and not have a match, to keep our local governments on the right pathway. So my advocacy here is to stand on the testing protocol, stand on the idea of a directed, strong, forceful, and guided recovery, and to likewise thank my fellow Houstonians and those who live in Harris County in Texas, thank the first responders, fire and police, thank the frontline medical workers, and thank Houstonians for abiding and listening to the stay-at-home order. Let me say to you that the national data says that you have saved lives. Continue to save lives. Listen to constructive counsel. We want you working. We want to provide for your businesses that you know are having challenges. That is in the federal government. But we want the mayor and we want the chairman and our city council members to have the tools that they need to be able to have the right kind of recovery. That's our task. The congressional delegation, bipartisan, House and Senate, is going to listen to our local leaders and fight for those dollars. Some dollars are coming soon, and they will be utilized by the city in a very smart way. That I applaud. And again, I am delighted to applaud Tashir, a longtime colleague, for his dynamic leadership on setting the tone for our businesses. Get out and get tested. You've got many sites. Do what is right for you and your families. Thank you, Mayor. Thank you.
And let me say, one of the reasons why I'm excited about Marvin and his willingness to accept this challenge is that he's had the opportunity to work directly in the private sector. He's worked with our federal partners. He's worked with the state officials, and he's worked with the members of City Council. And as I've said, very seldom have I seen someone who's garnered the total support of the members of City Council, but that's coming from me, and since I selected him, I would, of course, be biased. But let me call on the Mayor Pro Tem, Dave Martin.
Thank you, Mayor. I couldn't think of anyone to lead these efforts other than Marvin Odom. I had the opportunity to work very closely with Marvin post-Harvey. The area I represented, along with the rest of the city of Houston, was hit dramatically. And the influence that Marvin has with local leaders, with business people, with state officials, including the governor, all the way to Congresswoman Sheila Jackson Lee and the folks that are in D.C. to help us in this effort will go a long way. So my thanks to Marvin and his lovely wife, Mary Lowley, because you can't make this decision on your own, because I know you better. And your wife is just as given, even more given than Marvin himself. So, Mayor, couldn't have picked a greater man for this task, and I look forward to working with him, along with other members of City Council like David Robinson, who sits to my right. So thank you, and God bless us in this effort. Thanks for your help.
And I'll be remiss to say that Marvin and his wife, Mary Lowley, was just honored by Baker Ripley just a few months ago for their outstanding service. Let me call on Dr. Peirce, because Marvin will also be working directly with Dr. Peirce and with Director Steve Williams, Director of our Public Health Department. And as I said before, this virus is not yet under control. It still exists. We're adding 107 new cases today. The testing reached maximum capacity again early, so we need more. But let me call on Dr. Peirce.
Thank you, Mayor. 107 new cases today. It's 107 cases that theoretically were preventable. As we move forward, we've got new leadership here to help us move forward. I want to share with you a couple of things about transmissibility of the virus. And we've talked about the fact that this virus can be spread by people who are either asymptomatic, which means they have no symptoms. When I say asymptomatic, I don't mean they don't have symptoms at any given time. I mean they never develop symptoms. And then there's another group of patients who are what we call persons which are pre-symptomatic, which means when tested, they didn't have symptoms, but then days later that they did. So it's important to understand that there are people who are able to transmit the virus in both of those categories. And there's been enough research. The research is continually evolving. There's enough research coming out now to give some ideas of how big those groups are. So to give you some example, Dr. Fauci a couple weeks ago spoke that his estimate, based on some research, the same stuff that I've read, is that as much as 25 to 50% of the cases were spread by people who are either asymptomatic or pre-symptomatic. There's now a new report out of China, one report, but is the highest value ever, or highest value yet that I've read. And it suggested in that community in China, 79% of the cases were spread by people who had little or no symptoms. If you look at the Diamond Princess, and when they disembarked all the passengers from the Diamond Princess, and there were hundreds of people who tested positive, a full 50% had no symptoms. And so this weekend, a gentleman came up and he recognized me from television, and he expressed his disagreement with some public health containment strategies that we've been using. We had a very respectful conversation about it, and I was able to talk to him. And it occurred to me as we were talking, and he was lamenting about the economy and the need to get it restarted, and the problems that the public health containment strategies had placed on his particular situation. It occurred to me in talking to him that he was mixing something which I want to talk about today, and that is, just briefly, is that in order for us to get society going again, and we talked about this last week, it is all the more important that individuals do those social distancing things. Otherwise, we're going to see what is happening in some other communities around the globe, where as they start to reopen society, there's this big uptick in cases. Now, we all know that this isn't going to go smooth. No one has ever done this before. We can expect there to be some spikes along the way. What we don't want is for it to take off and crush the healthcare system. You've got a huge job ahead of you. you know that. We're all behind you. We're going to all work together well. But the public needs to do its part as well. So today I'm wearing a bandana-style face covering. And I'm doing that on purpose to point out to everyone just how easy it is to come up with some type of face covering. And you don't have to have the surgical masks that are built by or are made by somebody and sold and right now are scarce. And we would like for those to be used by the health professionals. So anybody can come up with some type of a face covering. The conversation I had with this gentleman today, I pointed out to him that if he wants to get society and economy started again, he needs to do his part, and he needed to put something on his face. And you know what? He figured it out, and he agreed with me. As I said, we had a respectful conversation. And just for everyone here today, I just want to point out, asymptomatic or pre-symptomatic spread is the thing that's going to keep us from moving as fast as forward as we can, and we do have control over that. Every one of us can have some impact on that. And that's by finding a piece of cloth and fashioning. And clearly I don't have it down just yet because this keeps sliding down, but I'm working on it, and you will too. Yeah.
Thank you, Dr. Person. You look pretty good in that, too. I mean, that,
It doesn't match either.
a gray suit will accessorize. That would be an accessory to a gray suit. You got on the black shoes, and you're moving in the right direction. Let me also say this face covering was also made by a grandmother in the city of Houston. This was not purchased. This was made by a grandmother and was delivered to me today. She asked what color suit I was wearing, and so I was going to wear today, and so she made this one specifically to accessorize this tie and black suit with this gray shirt and matching socks and shoes. So, so the point that we're making, this fashion will help save your life and the lives of other people. I hope not to see people going into stores without face coverings, in gatherings outside without face covering. Part of the task is to do an educational campaign very quickly to encourage people to wear the mask. And if we see that we're not getting the compliance that we need in order to really tap down this virus, then they will have to take some additional steps. Let me now bring up Chief Pena for his report for today.
Thank you, Mayor. Good afternoon. I'm happy to report that the status of the Houston Fire Department remains the same. We are at 51 firefighters in quarantine. That's maintaining what we've had in the last week or so. 31 firefighters have tested positive during the course of this operation. 20 of those have been back to work. So we're happy to report that we are maintaining our ability to keep our firefighters safe and protected. I too want to reiterate the importance of wearing the face coverings. This is the game changer in this was the fact that people can be asymptomatic and still be transmitting or shedding some of the virus. This mask is not to protect you, but it's to protect others from anything that you may be carrying. So it's critically important that we do our part, because in the end, the goal is to get our economy and our way of life back to as normal status as we can, as quickly as we can. Thank you.
Thank you. So again, Tashir, thank you so very much, and ZT for your partnership and your collaboration and encouraging other companies to do the same, and that's to cover their employees, and that way we can do exponentially more testing. I'll stop now, and we can all, whatever questions you may have to any one of us.
Okay, I'll begin with the first question from KHOU. This one's for the Recovery Economics Czar. So how will your functions differ from those of the county's Recovery Czar, and how will you overlap?
I think the best way to think about it is probably as co-leaders. So we'll be working hand in hand to represent the people of Houston and Harris County. So completely complementary. I think we likely bring different skills to the table, and I expect that to be a very good working relationship.
Another one from KHOU, also for you. Now that the price of oil has dropped below $0 a barrel, how does that impact your recovery strategy?
Yeah, well, let me just first of all say it's very personal, since I spent 35 years in the oil and gas business and still have some connections, but it doesn't really affect the recovery. I mean, let me just say, first of all, it affects so many people in our city and our county, and it's a pretty devastating impact. It weighs on our economy overall. But in terms of the requirements of a recovery and getting people back to work and the elements we have to have in place, I don't think it changes that.
Thank you. This was from Fox for Mayor Turner, and it's similar question. Today, the WTI crude for the month of May closed at negative 37 per barrel for the first time in history, and this, along with the historically low oil prices over the last few weeks, appears to be concerning for Houston, the energy capital of the world. What does this mean for those working in the energy industry?
Well, it's a significant impact. The price of the barrel of oil was already extremely low. It just went much lower. When it comes, look, the economy was already in the city of Houston and across the world adversely affected. I would speak specifically for the city of Houston, as we now are deeply engaged in the budgetary process. COVID-19 is going to have significant impacts. I will tell you, all 5 of my cadet classes, for example, will be deferred. Employees will be furloughed. Payments, for example, even to the Houston Zoo, will be deferred. There are a number of significant impacts that are taking place. And unless, for example, we receive some federal flexibility, as the Congresswoman and I were talking just last night, and we had a telephone conference call with all of our congressional leaders, including Senator Cornyn, Senator Cruz, and many, many others. I went through the list with them. And so the fact that the price of oil has dropped dramatically, this is the energy capital of the world. Of course, when it comes to employment, we'll be in hard hit. So we just have to take it one day at a time. That's one of the reasons why we are now talking about relief and recovery. And it's just ironic, with Marvin having spent 35 years in the oil and gas business, the former CEO of Shell. So he's uniquely adapted to deal with these occurrences and the other things that we've been facing as a direct result of COVID-19.
Mayor, can you just, following up on what you just sort of announced, specifically what additional cuts are you looking at? Are you thinking of 5 police cadet classes? Were there fire classes? How many employees are going to be furloughed? How much money are you looking at deferring? What can you tell us?
Well, our budget has been dramatically hit. Sales taxes have gone down quite a bit. So the recovery is not just outside of the city governance, the corporation. We are a corporation as well. We are a public corporation, but we're also impacted. And so as we talk about restarting and moving forward, those conversations are not separate and apart from the work that Marvin is doing. It's all a part. Everything has to be on the table. We represent in large part the infrastructure for many of these businesses and companies and nonprofits and these vulnerable communities. So we're all part. We are not immune, but those are things that we are facing. So and it's not any more unique than what other cities are facing across the country, but it's real in the city of Houston. I'm not trying to hide it. I mean, these are the realities. This will be the worst budget that the city will deal with in its history. I thought 2016 was bad. This one will be worse.
So, I mean, do you know how many employees you're looking at furloughing and when that would happen yet? Because some other cities have already done it.
Yeah, I know, I do. And with respect to other cities, yes. Mayor Garcetti in L.A., he laid it out very clearly in his State of the City on yesterday. So it's just, all cities are being impacted, and that's one of the reasons why, I've had several conversations with members of Congress, essentially saying that we need flexibility. We need flexibility with respect to the dollars that have already been awarded to the city of Houston. But that's a part of the relief and the recovery phase. And because Marvin has those relationships with our federal partners on multiple levels, and with our state partners and local partners and nonprofits, it makes him uniquely suited to lead the city of Houston's recovery efforts. So it's a part of it, and we'll deal with it, and we'll be methodical in our approach. But Houston is not immune, and every facet of city governance will be impacted. from police, fire, municipal workers, city services, all will be impacted. We are obligated to balance the budget, and that is exactly what we'll do.
Is there, and just following up what the mayor and maybe Marvin can speak to that, as we look at the recovery, the governor has already talked about, state parks open today. What are you guys looking at in the next week or two that Houstonians will be able to see as far as any sort of opening or not opening, what's going to change, what's going to stay the same? Anything concrete that we can see in our daily lives?
Well, I'm actually not going to preempt the opportunity to get together with co-leaders we talked about at the beginning from the county and start talking about how we would put some of those elements in priority order. I think the important part for today is to start to lay out the criteria for how we'll make those choices. So it's very much around the testing, the tracing, and being able to support a plan that we know will put people back to work and keep them healthy. So we'll be rolling out what that looks like in more detail as soon as possible, but I'm not going to get ahead of that game.
Mr. Mayor, earlier today, County Judge Lena Hidalgo had said that 24 to 48 hours prior to the rodeo being shut down, that she had made the decision to shut it down, yet it seemed that it was the city's health department that acted on that. Who exactly made the decision to shut down the rodeo? And second question that was part of that is some emails have come out showing that there was a lot of back and forth leading up to that decision as to what step to take. Any early lessons learned about anticipating something like this in the future?
Let me just respond by saying that, and I'm not going to go back and forth as when anybody might have made a decision to shut it down. What I will tell you in terms of the chronology is that I was leaving a town hall meeting in District J with Council Member Pollard, and that was on a Tuesday night when I received a call from Dr. Purse at about 8:30 p.m. that night, in which he indicated to me that there was a security guard from Montgomery County who had served as a security guard at the cook-off at the rodeo. And he had been tested, presumed to be positive for COVID-19. And it was at that point, once that information was made available to me, I indicated to Dr. Purse to notify people at the rodeo of that connection, and that it was a serious connection, and that at that point, with that contact, we were going to have to bring the rodeo to an end. And on the following day, Wednesday, is when the rodeo came to an end.
This is a question from Telemundo. A new study by Self shows that there is a shortage of health care workers in Houston, placing the city at number 10 compared to other major areas. According to the study, there is a 3.35 healthcare workers for every 100 residents. What can you say about this?
So I don't know how that, in those statistics that they're talking about, how that may compare to other communities, but Houston is the home of the Texas Medical Center, which is a very robust medical center. Houston is also a very large city, and we have lots of universities and schools, and we're constantly training folks. We have people from around the globe who come here to be trained, and so I think every community in the United States is probably medically underserved to some degree or another. When you look at the official map of medically underserved areas across the United States, most people think that would be someplace that's rural or frontier, and in fact it's urban. And so depending on how you want to slice the statistics, you can get them to say pretty much whatever you want. We do have a very strong, robust healthcare system in the Houston area, but yes, it does meet the definition of medically underserved by the federal definition of that, as does every other major metropolitan area across the United States.
Mayor, I just was wondering if you could clarify a little bit about what Marvin has the authority to do as recovery czar, given that he still reports to you. You still make the final decisions on major actions, I would presume. But just what does he actually have the authority to make decisions about, and what would you maybe say to someone who's skeptical about why do we need a recovery czar for this?
Well, I will tell you, number one, that these are huge issues, and it requires a great deal of expertise, and it requires a great deal of commitment and time. And quite frankly, Based on what Marvin did during Hurricane Harvey, the job, he just did an exceptional job assembling an excellent team, forging very strong collaborations with others and partnerships, and the result was masterful. And he laid the groundwork for what we needed to do moving forward. And he committed a great deal of time to that effort. It was simply exceptional. With respect to this, I'm giving him broad discretion and authority. Quite frankly, if he speaks for me. And it's that much trust and admiration that I have for him. I know he loves this city. There's no question about that. And number two, highly capable. And when you've been the CEO of a large corporation like Shell, there's no question about the competence level. When we're talking about Harvey, we thought Harvey was big. And he and I had this conversation. We thought Harvey was just the big disaster. Quite frankly, this virus and the impact that it has had is even bigger. And case in point, what the price of oil is right now. Okay, stores and you name it being shut down, employees out of work, the impact on vulnerable communities. No part of our economy or community have been left untouched. And so we are needing someone, and not just me, the city is needing someone who can focus, establish those teams, those partnerships, build those collaborations, work directly, for example, with the county. And I would venture to say it's not just Harris County. We have partners in the region, okay? And then we have our state partner, and we have our federal partner. And so it's going to require a holistic, comprehensive strategy on how we reopen, restart, and how we move forward. And there are some precursors to that. Now, we talked about testing. And then the question will be, as you move forward and if things start to spike, what adjustments do we need to make in our plans and our strategies? How do we make sure that we leave no community behind? That's important. And then how do we become more resilient to future pandemics like the one that we are dealing with right now? So broad discretion. It's going to take a lot of collaboration. And so he has the authority, Marvin has the authority to forge and establish and build those task force, those teams to develop that comprehensive plan that we can utilize for this particular challenge and to mitigate or be able to be more resilient to deal with the challenge that comes in the future.
Yeah, we were talking about testing. You said that testing has to be ubiquitous before we, resume normal life.
Right.
Can you give us a sense of what scale is actually needed to kind of meet that?
Well, ubiquitous means widespread. That means that I gave you a numerical number. Right now, we can do from the 2 public sites, we can do a maximum of 1,000 tests a day. We are meeting that goal right around 3 o'clock, 3:30 every afternoon. And we plan to be out there till 7 p.m. So we need to triple at least that capacity. So 3,000 to 5,000 tests per day, if not more. And that's just on the diagnostic testing. We also need to do contact tracing. And that requires an army. That's labor intensive. So we need to be doing that. New York is going to start doing that this week. Okay? And that's the precursor to opening things up. The example that I like to use, since Marvin was a part of Harvey, when the storms come, like Harvey, we looked at the radar. We knew where it was, approximately what time it was going to hit, and we knew when it left. You can look at the radar. With respect to this particular challenge, this virus, how do you know where it is? And you know where it is by testing. And you know how pervasive it is in our community through testing. And you know how to isolate and quarantine through contact tracing. That's testing. And if you don't do the testing, you don't know where it is. And just because you look great, look fine, asymptomatic, doesn't mean that you're not going to infect somebody else. So you can reopen with people who look fine, asymptomatic, but you reopen, everybody's sitting down next to them in a restaurant or working next to them at their jobs, and then all of a sudden they are infected again. And case in point, 1918, Spanish flu, huge parade, everybody thought things were fine, and a few days after, every hospital in Philadelphia was full, and 4,500 people or so lost their lives. We don't want that to happen. And so let's learn from our history. So let's put forth. So looking at a relief recovery effort, and Marvin will lead that effort, working directly with the county and with others. But let's be very measured and very methodical in our approach.
And just in terms of getting to that benchmark you mentioned with testing, the city relies on, federal funding primarily to operate these sites. Is there any indication that maybe that amount of funding would ramp up at some point down the road so you could get there? I mean, I'm just trying to get a sense of how we're going to reach.
Well, I think the best person to speak to that is a federal partner.
In the coming days, we should be passing legislation for $25 billion for testing. The question is whether or not we will include contact testing, $310 billion for our PPPs and small businesses, with a set aside of $60 billion for our small businesses. What we also have to do, and the mayor is very right, and local and state officials are very right, is they need flexibility. And today I asked for flexibility on the testing dollars so that cities and counties can utilize those dollars in this testing protocol where potential hotspots or vulnerable populations. I heard Marvin Odom say that, and I'm grateful for the fact that he used the term vulnerable populations. The mayor has said that, and so flexibility so that Dr. Peirce, working with the Texas Medical Center, UMCC, and other medical facilities, can make the right decision or give us the right guidance of how these testing dollars can be utilized. So that is what we're attempting to do. But in the bill that we're now watching go through the House, and we will be back in Washington tomorrow, has $25 billion. And our goal is to push it out to our local officials, but it is also our goal to come back and provide more funding, because the real goal is 5 million people a day across the United States, because we have not yet tested 1% of the American people. If we're near that, that's about it that we've done. And Texas is also in great need of testing because its numbers are not high.
So let me just say in closing, again, I do want to thank Marvin Odom again, and I want to thank Tashir Badur again for what they are doing. Look, the bottom line is that we are working through these challenges, even as the mayor of the city of Houston. I certainly recognize I cannot do everything, but I do recognize that you need capable, competent, highly qualified folk to be a part of your team in order to best represent the city of Houston. And today, without reservation, without any hesitation, we have added a highly capable, competent individual to our team to lead our relief and recovery effort. And after intense negotiations over salaries and recognizing that we're in hard economic times, I'm just pleased that he lowered his demand. It started at 0, it ended at 0. And again, because of his love for the city and his wife and his family, because I do want to acknowledge that now. I do want to acknowledge, Marilu, thank you. I want to acknowledge his wife and his family because it takes when you're doing it right, and just like he did with Hurricane Harvey, Marvin gave a great deal of his time to that effort, and Houston has benefited from it and will continue to benefit from his service. So thank you so very much. Thank you all.
All right, Mayor Turner there announcing the city's recovery czar, Marvin Odom. If you recognize that name, he held the same job, an unpaid position, right after Hurricane Harvey. So he knows what to do when disaster strikes the city of Houston. A former Shell Oil president. He will get to work with the county's recovery czar, a state representative, Armando Wally, and they will get together and figure out the best way to safely reopen things that will include, as the mayor and county judge have said, robust testing in the city before they will feel comfortable reopening things, with the city yet not hitting its peak of COVID-19. All right, the 411 starts right now.
The 411 on KHOU 11 News.
A crash in the oil markets, and for the first time in history, oil is selling now below